Obesity is a growing problem worldwide, and its health consequences can be severe. In addition to increasing the risk of heart disease, stroke, and other chronic illnesses, obesity can also have a negative impact on mental health and overall quality of life. As a result, many people who struggle with excess weight attempt to lose it through various means, including diet and exercise. However, research has shown that maintaining weight loss over the long term can be incredibly challenging. In this video, we will explore what research says about long-term weight loss maintenance and why it is so difficult to achieve. We will dive into the psychological and behavioral factors that contribute to weight regain after initial success, as well as the limitations of traditional weight loss interventions. Finally, we will discuss potential strategies and interventions that may help individuals overcome the challenges of long-term weight loss maintenance and achieve lasting success. Maintaining weight loss over the long term is a challenging task that has been extensively studied by researchers. According to a study published in the American Journal of Clinical Nutrition, while many people are able to successfully lose weight, the majority of them regain the weight within a few years, with only a small percentage being able to maintain the weight loss for a longer period of time. This phenomenon is commonly referred to as weight loss recidivism, and it affects a large proportion of individuals who undergo weight loss treatment. Furthermore, research has shown that the likelihood of regaining weight increases with time, and that the majority of individuals who maintain their weight loss for longer than 5 years have to maintain a lifestyle that is significantly different from the one they had before their weight loss. In fact, a study published in the Journal of the American Medical Association found that after 2 years of a weight loss program, participants regained an average of 50% of the weight they had lost, and after 5 years, they had regained 80% of the weight lost. These findings suggest that while weight loss can be achieved, maintaining it over the long term is a difficult task that requires ongoing effort and dedication. To further support the challenges of long-term weight loss maintenance, a study published in the American Journal of Clinical Nutrition followed over 120,000 men and women for up to 20 years. The study found that even those who initially lost a significant amount of weight, approximately 5 to 10% of their body weight, were more likely to regain the weight than to maintain the weight loss in the long term. Another study conducted by the National Weight Control Registry, which tracks individuals who have lost at least 30 pounds and kept it off for at least 1 year, found that less than 20% of participants were able to maintain their weight loss for over 5 years. These findings highlight the difficulty of sustaining weight loss over a prolonged period of time and emphasize the need for effective long-term weight loss maintenance strategies. To support the claim that long-term weight loss maintenance is challenging, there have been several studies conducted on the topic. One such study was published in the American Journal of Clinical Nutrition in 2015. This study followed up with participants from the TV show The Biggest Loser 6 years after their weight loss. The researchers found that, on average, the contestants had regained 70% of their lost weight. Another study published in the Journal of Obesity in 2014 tracked 14 participants who had lost a significant amount of weight through diet and exercise. After 6 years, 13 of the 14 participants had regained at least some of their lost weight. These findings highlight the difficulty of maintaining weight loss over an extended period of time. Other studies have looked at the factors that contribute to weight regain. For example, a review published in the Journal of the Academy of Nutrition and Dietetics in 2014 found that a lack of social support, poor self-efficacy, and high levels of stress can all increase the likelihood of weight regain. Additionally, a study published in the journal Obesity in 2015 found that changes in hormones that regulate appetite and metabolism can make it more difficult to maintain weight loss over time. These studies suggest that there are multiple factors at play when it comes to weight regain and that simply following a diet or exercise plan may not be enough to sustain long-term weight loss. The physiological and behavioral mechanisms underlying weight loss maintenance are complex and multifactorial. One potential explanation is the body's tendency to defend against weight loss and promote weight regain. When an individual loses weight, their resting metabolic rate decreases and appetite hormones increase, leading to increased hunger and decreased satiety. Additionally, research has shown that weight loss can lead to changes in brain activity that promote food-seeking behaviors and reduce inhibitory control. Behavioral factors also play a significant role in weight loss maintenance. Adherence to diet and exercise programs, self-monitoring of weight and food intake, and social support are all crucial factors in achieving long-term weight loss maintenance. However, these behaviors can be challenging to maintain over time, particularly in the face of competing demands and stressors. Furthermore, the food environment and societal norms surrounding food can make it challenging to maintain weight loss. The prevalence of highly palatable, energy-dense foods, and the normalization of overeating in social situations can make it difficult for individuals to maintain dietary restraint and avoid overeating. Social and cultural factors can also play a role in weight stigma and body dissatisfaction, which can undermine efforts to maintain weight loss. Despite the challenges of weight loss maintenance, research suggests that it is possible to achieve long-term weight loss success with a combination of behavioral and pharmacological interventions. Behavioral interventions that emphasize sustainable lifestyle changes and ongoing support have been shown to be effective in achieving and maintaining weight loss over time. Additionally, pharmacological interventions, such as weight loss medications or bariatric surgery, can be effective in achieving significant weight loss in some individuals. In conclusion, maintaining long-term weight loss is a challenging and multifactorial process that requires sustained effort and ongoing support. Understanding the physiological and behavioral factors that contribute to weight regain and identifying effective interventions to promote weight loss maintenance is critical for improving the health and well-being of individuals struggling with obesity. While the Think of Dieting implementation intention is not a miracle cure, research has shown that it can be more effective than other implementation intentions, such as avoiding specific foods. Of course, the success of implementation intentions depends on a range of other factors, such as the attractiveness of the food, an individual's level of self-control, and whether their control is momentarily depleted by fatigue or other factors. To make long-term weight loss maintenance possible, it is crucial to address the underlying psychological and behavioral factors that contribute to weight regain. One approach that has shown promise in preventing weight regain is the use of implementation intentions, which involve forming specific plans that link situational cues with the intended behavior. In particular, implementation intentions that prime the weight control goal, such as think of dieting when faced with high-calorie foods, have been found to be effective in reducing consumption of these foods and promoting weight loss maintenance. Overall, while the challenge of long-term weight loss maintenance is real and complex, it is not insurmountable. By understanding the factors that contribute to weight regain and implementing evidence-based strategies, individuals can increase their chances of maintaining a healthy weight over the long term. It is important to seek support from healthcare professionals and engage in ongoing self-reflection and behavioral monitoring to stay on track towards a healthier lifestyle.